when it comes to the protein amounts, it doesn't matter really, as long as what you're having over the course of a day is substantial enough to meet your requirements to adapt and recover from the training output that you just gave. You don't really want to be training less than maybe an hour and a half after eating. I'd give it a window of time. Now, some people out there can have a ribeye steak, loads of eggs, and just train immediately after. Some people can do that. It's important to be fed before training. My rule of thumb thing for everything in regards to protein is eat when you're hungry, don't eat when you're not. Your hunger signals will promote your appetite or provoke your appetite as and when they need. And when it comes to different supplements and pre-workouts, post-workouts, all sorts of things, they're products that aim to sell something to you. They're things that you don't need. They're supplementary. You can use those things, but they're not needed. I'd say over my training career of using all these different things, I'd say they made a marginal increase in performance, but in terms of how that translates to long-term physique progress, I couldn't say it'd be worth it.
Okay, good morning, everybody. Today we have Jonathan here with us. Jonathan, good morning. How you doing?
Good morning. Good evening, where I am. How are you doing? I'm not bad.
I'm doing quite well. So where are you located? You sound like you're in the UK or something like that, I'm guessing.
Yeah, south of England, where I think you're visiting soon in a few weeks. So I'm hopefully going to be able to meet you there, I think.
Oh, nice. Yeah, I think I'm in Sheffield. I'm not sure. I think it's more north. Isn't that kind of farther north, I'm thinking? But I'm not sure.
I'm coming up there to go see you and Dr. Chafee and a few others.
Okay, wonderful. Well, I'll be looking forward to meeting you in person in just, what are we on, May 2nd? So about 2 weeks from now, a little over 2 weeks from now. Awesome.
Excellent.
Well, tell us a little bit about your background for those that aren't familiar with you.
Yeah, so I came onto this show perhaps, 4, 5, 6 months ago. I elaborated a bit around my diagnosis of autism and my issues with my back. So I've had recent spine surgery. I talked a little bit about that. I'm also a carnivore diet proponent. I advocate for that very heavily. And I've been on the carnivore diet now for around 3 years or so. I'm what you call a carnivorous bodybuilder. So my goal is to build muscle and have the best body composition I can have, whilst also aiming to maintain the best health status I can. So I've been following the likes of yourself and lots of people in this sort of space to uncover the truth about diet and just generally develop myself as a person through physical and mental status. Thank you for your efforts in this community, and I greatly appreciate what you've done for myself and many others over the span of the last few years.
Yeah, and I think the last time we spoke, you were about to have spine surgery, so you actually had it. Assume that went okay, hopefully, for you?
Oh, yeah. Yes, thank you. That was on December the 12th of last year, and that was successful for the most part. Looking back now, my spine is no longer giving me extreme pain that I used to have. I have 2 approximately 3-inch incisions on my lower back. On either side, they did what's called the Wilts approach. That's a methodology they use people with a heavy musculature, because going down the center and putting that muscle apart is very tricky. So they have to go directly through each part of my lumbar spine muscles. And with that, I've noticed a general improvement in my well-being overall. I'm not as fatigued as I once was, although I have had some issues as I think a result of the surgery. One thing was that they gave me antibiotics after the surgery, which were not indicated or needed, in my opinion, saying that I didn't get infected or anything. So it's perhaps a good thing, I don't know, but I don't think there's a much indicated need in the research to really give someone antibiotics. That has given me some issues with my digestion, my mood, my overall health, my fatigue levels. But I think I'm, for the best part of it, overcoming a lot of that. Saying that as well, I've had some reoccurring hip pain as a result of the surgery. And I'm not sure what's happened there, but I've been assured by my surgeons that basically it's a result of muscular damage to the area and a bit of rejigging things. So obviously when you have a major operation, there's things which occur further downstream which can affect your mobility, the way you walk, where you stand. Interesting enough, I measured myself prior to and after surgery, and I'm the same height, so I've not lost or gained anything. That's something I was quite concerned about. But for the most part, I'm in a much better state than I once was. I'm living in a better way than I was, I'd say, overall. I don't sit in the extreme pain anymore. It's just the case of when I'm getting in out of bed and you're sat down for too long, then I get a little bit of hip pain. But like I said, for the most part, all good.
Yeah, so just a couple comments. And prophylactic antibiotics are pretty routinely given with almost all major surgeries. That's a standard of care, and whether or not that's efficacious is required in every situation. I think I don't, like I said, I think you would, a lot of surgeons would be accused of malpractice if they
Yeah,
did do that, if an infection did occur. And so it's not that they
of
have,
course.
but
Yeah.
it's kind of a precautionary thing that's often done. Now, you said you were happy that I couldn't hear if you said your height or your weight didn't change. I think you said your
Oh,
height.
sorry. Yeah, my height. I'm just under 6'1", and I'm still just under 6'1". So I'm the same height. Yeah.
They couldn't make you any taller. So you mentioned the incision, but was it a fusion? Was it a disc replacement, or what did they do?
All of the above. So it was a fusion, a disc replacement, laminectomy, discectomy, a lot. Effectively, I now have 4 bolts, 2 rods, and a replaced disc in my L5 S1 vertebrae area. So yeah, they're quite mighty things. As you could probably know, they're quite big old bolts.
Yeah, they're quite strong and designed that way. So before trying to bodybuild with severe back pain has got to be challenging, because whenever someone has a back, affects pretty much almost every movement you do, and trying to train around that can be, every once in a while I have an injury I have to train around, but usually it limits you for a while, but constantly doing that's got to be challenging. And with the mindset I guess not the mindset, the situation of being a carnivorous bodybuilder, a lot of people are out there under the impression that you must consume carbohydrates to build muscle. Obviously, I don't think the literature supports that or practical experience, but what is your experience being able to put on muscle as a carnivore? And I guess because you did this before this as well with a more mixed diet, I suppose.
Yeah, I've tried it a number of different ways, and I'm sure you have as well, Shawn. So like building muscle, losing fat, improving your training performance. I'd say if we start training performance, I've not noticed any detriment. Maybe the first week or two when I started it, there was a very minor dip, but once I got into that fat adapted state, which for me happened quite quickly, I must say, I had no training performance issues. My logbooks were excellent. I found things that have improved in training as a result of downstream effects from the carnivore diet itself. So I sleep better, I recover better, my digestion's better. That's meant I've been able to assimilate the food I'm eating much better and put that food to good use. All that said, I'd say my musculature is greater than what it was prior to the carnivore diet. And that's from a point of view that I've been bodybuilding now for about 14, 15 years. I'm at my advanced years in terms of like training career. So I'm nearly 28 years old, so I'm still relatively young, but saying that, my training time has been quite lengthy. And yeah, what's been fascinating with the surgery and the bodybuilding is I made a very quick recovery back into the gym. Obviously, my inflammation levels were better regulated on the carnivore diet, and I was putting all the raw materials on board that I needed to develop and grow, repair strong bones, and that sort of thing, get everything sorted back to how it was prior to surgery with obvious surgical manipulations. And with that, I was able to start training to some capacity after 8 days post-surgery. So obviously I wasn't doing anything near to what I was doing before. But what I was doing is half reps of the dips, push-ups against the bed sort of thing. I logged some of this stuff on my YouTube channel, but it's split squats, all very basic things where your lower back isn't bent over. There's a staggered approach to everything I've been doing. And essentially, I've looked through my logbooks and I've done roughly 72 workouts since my surgery. And each one is gradually, I've added a bit to it. I've layered onto it the intensity, the training volume, the exercise difficulty. And I'm kind of at the point now where I just need to cruise for a bit and really let it heal and make the most of my recovery. But I'd say all in all, building muscle, carnivore diet, it works.
Yeah, I'll just comment on my own personal experience because I'm 56, so I'm exactly twice your age. And I started training about the same time you did when I was a 13, 14-year-old kid. So I have 42 years, 43 years of training experience behind me. And legitimately at 56, I'm now stronger than I was at 46, 10 years ago, which I'm quite happy about. And that I do contribute almost much of that to the diet because my training intensity really hasn't changed much. If anything, my training intensity has probably decreased somewhat just due to time constraints. But so clearly high quality protein and not eating garbage really makes a difference on that without a doubt. You'd mentioned at the very beginning of this autism, and that's an unrelated, obviously it's different from the bodybuilding aspect, but I want to just touch onto that a little bit. And so how has diet impacted that, and how had autism, or how does autism affect you, in your day-to-day life, and how has carnivore either helped or not helped that?
That's a very good question. Thank you for asking that, because I know it's something which is often dismissed or not talked about just because it seems uncommon. My experience has been that my symptoms are now much improved. Prior to the diet, I was very unsociable, quite a lock away, quite homebody kind of guy, quite angsty as well, quite hard to be around sometimes. The sensory input would be quite challenging sometimes. So what you might notice is the red light sort of thing. I try to maximize all the biohacks that I can, not just through the diet itself, but all the things around it, which I've learned as a result of listening to people like you and many others in this space. And also saying that, I think some of the bigger impactors have, of course, been the regulation of blood glucose. So obviously not now what I was eating before on a conventional bodybuilding diet would be loads of Haribo sweets, rice, potatoes, and starch, sugar all day, every day. Now I'm fat fueled. It seems to work. My moods were balanced. Things are more stable. I notice as well, it's a condition called synesthesia, which is where you experience sensations as you're talking and doing things. It's very tricky to outline to people that perhaps don't understand it. But that can be quite challenging at times. It still is challenging. However, it's much better managed using the diet that I'm currently using. Similar to people that have a processing disorder. They can't take in lots of information. They have to zone out kind of thing. They have to lock themselves away. I'm able to tolerate more in terms of being around people, taking in information. It's actually probably improved my capacity to learn as well, which is quite a big thing. Is obviously I've got a very small YouTube channel, but like yourself, when you're taking lots of information, you're trying to deliver information, help improve the lifespans and health spans of other people and do good work, basically. My knowledge capacity has greatly improved as a result of the diet, which is something I perhaps always struggled with as a child. Take information when you're tired, when you can't concentrate, when there's too much external stimuli. That can be quite challenging for myself as an autistic individual. And overall, I'd say the diet has greatly impacted it from the blood glucose standpoint, obviously omitting the plant foods, the oxalate, the lectins, the gluten, all that kind of thing. That has had a profound effect on me, which I highly advise anyone with autistic spectrum disorder to actually look into a lot further. And there are studies on these things. I'm not just talking here out of pure speculation. There is some indication that at least these things are negatively impactful to the diet if you include them. So yeah, that's kind of me for autism and how it's improved through the diet.
Yeah, there's a group on Facebook called the Autistic Carnivores, run by a friend of mine, Tom Clark, and he has thousands of members now of parents and adults with autism. They've noticed significant benefit. And there is literature looking particularly with the ketogenic diet on autism that have been published. And so it is there. And we also see that fat in the diet actually has been shown to minimize anxiety because of, like you said, that stabilization of our blood glucose levels. So when they're rapidly fluctuating, sometimes our moods are tied to that, or feelings and things like that. So there is a role for that. And like I said, a lot of people, myself, my baseline mood is pretty chilled out and pretty happy. That's my baseline. And then obviously things happen and it changes a little bit, but it's generally pretty stable. What learning curve things did you have to figure out when it came to training bodybuilding with carnivore? Were there any kind of things you had to do differently?
In terms of diet itself, not really, no. All I'd say is that I can eat less meals prior to training and feel just as energized. So prior to the carnivore diet, I typically need 3 or 4 meals in my system. And that might be 3 or 4 meals in. Then obviously I have 6 meals over the day, like a typical bodybuilder would. Nowadays, it's probably 3 to 4. If I'm really trying to gain weight, it'll be 5. But right now, I'm recovering from surgery. I can't train to that sort of degree. I probably don't need 5 anyway. But yeah, it's 1 meal before training now. And that fuels me just fine. I get through a workout, high intensity workout. It's lasts approximately an hour. I'm currently at somewhere between maybe 10 to 12 very intense sets, usually to at least concentric muscular failure. It's true concentric muscular failure where otherwise it would flatten me. Outside of that, yeah, I quite enjoy training, and the diet itself has definitely reduced some like the inflammation pains you might get from having sore joints and that sort of thing. So when you're working the deep end ranges of the squats, the leg press, the hack squats, sometimes people would complain about having bad knees. I have bulletproof knees. So that's definitely something where I can say the diet's definitely improved that in that regard. In addition to that, all I can think is that I recover faster from workouts. So my delayed onset muscle soreness seems to be slightly less. I attribute that to the fact I'm not putting in toxic seed oils in my diet, high omega-6 inflammatory crap, basically. I definitely think that's had a positive impact. So my inflammation's better modulated, recovery's better, sleep's better, and that's added to my training. And that's compounded an effect basically where I'm able to start building more muscle. And at this point in time, I'm currently only 2 kilos off my maximum muscle mass I've ever had on my body at any given time. And that's on a carnivore diet. The only reason why I had more at another point in time was because I was juiced to the gills and eating 6,000 to 8,000 calories per day. I was also saying that probably close to 20% body fat and 125 kilos. So it's a heavy weight. It's 280 pounds or something. Now I'm cruising somewhere, I don't know, between 10, 15% body fat. Probably, I guess, maybe 25 pounds of my contest lean, shredded stage weight. It seems to be manageable in that sense. It's a lot easier to manage that. My appetite, I hit that bliss point when I've eaten enough. Okay, I don't need to eat anymore. That's it. I no longer have this like urge to binge eat and I need all the carbs sort of thing. That doesn't exist anymore. And the muscle just stays on me. It's been very significant. And like I said earlier, my recovery from the surgery has been exponentially fast, like absurdly good. So I'm really pleased overall with how it's affected my training. And as people like you and I, Shawn, we like to train and build our bodies and do different things. That's important to me. So now I can look back and think, yeah, with this diet, it's definitely altered things in the long term. I'm going to get a lot more training years out of myself and hopefully be training by the time I'm 100 years old.
Yeah, that's my mindset. I'm going to be training till I'm dead, I hope. And hopefully that's a long time down the road. But one of the things you mentioned about surgical recovery, and we do know, I mean, there's actually literature posted on this for trauma recovery, surgery recovery, burn recovery. Protein requirements tend to be recommended to go up something like 10 to 15%. I'm just kind of curious, what does your protein intake look like now on carnivore versus what it looked like previously with a mixed diet?
Yeah, so with a mixed diet, I was in a different frame of mind. It was all about mass gain as much as possible. More is better kind of thing. What I've noticed now is my protein intake is typically at this moment around 200 to 250 grams per day. I could probably even get away with less than that, maybe 180 or something. I think now I'm looking back and thinking I did not need 300 plus grams of protein. I was probably fueling some kind of food addiction I had and some kind of weird, strange mentality I had that you needed all this protein to build muscle, but I've not found that to be the case because I've built muscle in the last few months. Regardless, I started this year with approximately 87.5 kilograms of fat-free mass. I now have around 90 kilograms of fat-free mass. And in that time, I've recovered from a spinal surgery. So that kind of shows testament to the fact that, you don't need loads of protein to build muscle. The thing is, a lot of people in this space, they'll look at protein as the way to hit satiety, eating like pounds upon pounds of meat. And I don't think that's the reality of people that need to build muscle. I think the reality is you have two individual levers. I'm assuming you're following the carnivore diet, and that is one is protein and one is fat. Protein is the building blocks and fat is the energy substrate. I think a lot of people typically come from the standard Western diet or the conventional bodybuilding diet. They have a low fat intake because they never realize how much fat they need to eat. So when you guys are watching this, you're actually looking at ShawnBaker's videos, and when he's eating steaks and things, he's eating fatty ribeyes. There's fat on that meat. And that's how he's getting his fuel in. He's not just eating lean meat. So I think one common mistake that bodybuilders make is that they don't eat enough fat. They overdo it on the protein. And that's why a lot of people have digestive issues and feel tired. So I definitely think there's a protein and a fat requirement. People need to find out for themselves what that is. So yeah, I think protein intake, you don't need hundreds of grams. You just need enough. And enough is good enough.
Yeah. If you look at the literature on what it takes to build muscle, or somewhere in the range of 1.2 to 1.6 grams per kilo. Some would suggest a little higher, but yeah, my diet is probably around 70% fat per calorie. And that's exactly right. You have to have fat as your energy substrate if you're on a carb-free diet, which is largely what I do. I'm just curious as to what you're eating. You said up to 4 times a day. at maintenance phase right now, and then maybe 5 times. What does that look like? Are you including eggs in there? Are you including dairy? Is it just meat, or what does it look like for you?
Yeah. So what I've found is, as many people in the space have found, is if you add in dairy to your diet, it does seem to keep weight on, or in some cases add weight on. As I've increased the dairy in my diet, it does seem to be that I've gained weight. Not necessarily a bad thing, but when you're struggling to digest food because of the medications I mentioned earlier, it seemed useful to me at this last period of a few months to include a lot more dairy in, just to keep the weight on. Now, saying that, like, a typical day of eating for me is a very mixed carnivore diet. I don't have just ribeye steaks or just this, that, and the other. I probably had two to three steaks this whole year. Most of my diet is essentially ground beef, eggs, chicken thighs sometimes. I eat lots of oily fish, lots of mackerel, lots of salmon, dairy, so milk, raw cow's milk that I have. I was able to get some raw cow's colostrum recently, which is quite cool. And yeah, some raw cheddar and raw cheese of different kinds. A very mixed carnivore diet. And I think anyone trying to build muscle would find it advantageous, if they can include those foods, to include them. It's very hard to overeat on one food. If you're just eating beef, it will be very hard to overeat. So it works great as like a fat loss tool. But if you're trying to build muscle, there is some element of hyperpalatability to a mixed carnivore diet, which is something I quite like for myself and anyone that's really trying to build a substantial amount of muscle.
Yeah, fair enough. There's a question about intermittent fasting or fasting. There's some evidence that fasting will, after 2 days or so, raise human growth hormone. Whether that's actually beneficial for building muscle, I have questions about that. But it sounds like you don't take days off of eating. You just pretty much eat 4 times a day to build muscle. Do you see any utility can you see any utility where fasting could be used to actually build muscle?
I think the idea around that is to increase autophagy, which is a construct, as we both know. It's not really something you can measure. I think for myself, there is a rate of protein synthesis that I'm trying to acquire. There's a turnover of protein synthesis in my body. If I lower that amount on a given day, I'm not going to maximize my gains. Now, we're talking about, maybe say you do it 1 day out of every 28 days. It's 1 out of 28. It's not a big deal. We're talking margins, really. But the more advanced someone gets, they find that the more accurate and more focused they need to be on getting that protein synthesis up. You don't necessarily have to eat 4 times per day. I don't think the benefit of eating 4 times a day over one is significant. It's just for myself, based on what I found in my anecdotal experience to be better for myself. Now, most people, 1 to 2 meals, completely fine. The thing about fasting and growth hormone is, yeah, your growth hormone will go up several hundred or thousands of percent in a time when you've got no substrate in your gut, basically. And that'll go up even more as the hours and days go on. The problem is, growth hormone itself is a bit of a misnomer. Growth hormone is explained as a growth hormone, but it's actually an anti-catabolic hormone. How do we know that? In studies where they've given growth hormones to patients, people have typically lost body fat, but they've not gained substantial amounts of muscle mass. So to me, that says to me, okay, it's great for losing fat, but if you're weight training in the gym, you're not putting in substrate to repair tendons, tissues, muscles, then you could be setting yourself backwards and potentially have an injury if you're, for example, dehydrated, if you're not properly fat adapted to train in a fasted state. So I think for myself, at least, fasting overall is not beneficial. Now, there are indications where someone might find it useful if people binge eat, if they're trying to reduce inflammation. There are definitely indicated issues that I'd find useful for some people. There's people out there like with severe arthritis. Yeah, that can be very useful, fasting, perhaps dry fasting even. But for myself, there isn't a specified need for it. So I can't really warrant doing that in my diet, at least. But yeah.
Yeah, when people tell me about the increases in growth hormone, or I think without the actual substrate to build muscle in the system circulating, is a moot point. It doesn't really matter. So I just, for the record, don't fast for a long period of time to try to build muscle. It's not going to help you in any significant way. What do you have? What is your plans right now for competition? Your bodybuilders compete typically. Do you have some targeted competitions coming up, and what is it going to take for you to get from where you are now to there? Obviously, there's going to be some phase where you have to cut body fat, and how do you intend to do that?
Yeah, that's a very good question as well. My next competition I have lined up is roughly 530 days away. Yes, I plan my competitions that far in advance. there's an element of being hyper aware and understanding what comes into training and diet when you go into a competitive phase. You have to have your ducks lined up in a row, so to speak. And that show that I'm looking to compete in was actually the last show I lost. And so far, as it stands, I've won every show that I've ever lost. So I'm trying to keep on that sort of a kill streak. So I'm looking at that thinking, okay, I'm 520, 530 odd days away. What can I do to maximize my chances from then? So right now, it's a case of recovering from surgery, doing it all strategically, methodically, making sure I'm 100% prior to actually starting any kind of real bulking up or cutting phase. One thing I will say about what I do prior to the dieting phase itself is that I would aim to maximize my food intake prior to the dieting phase. So what I'm effectively doing is what people are talking about in the carnivore circles recently as being a priming phase. And that's essentially what I do. So I'll be upregulating my metabolic rate and putting as much food in my system as possible. So when I actually do have to drop the hammer, cut food back and slowly diet down, that'll be a case of reducing food intake very slowly, but I'll be starting from the highest possible energy intake that I can. We don't want to suffer more than we have to when it comes to dieting. What I have noticed for the carnivore diet itself is that your hunger signals are much more aligned with what your body needs at a given time. You don't get this excess blood glucose issue that I mentioned earlier. So what I found is I don't get severe hunger signals really ever. And that's even on days where I just don't eat much because I'm busy doing work or something. I find I can go hours without eating like much better than I could before. So the dieting itself is much easier. The bulking, however, can be challenging, mainly because you are emitting a whole food substrate and the energy from carbohydrates. Everyone that's watching this knows how easy it is to overconsume carbohydrates. It's laden in all our foods in the Western world nowadays, so it's a tough one. But saying that, I think if you're training hard enough, you have that intensity, you have that reason to initiate more food intake, your brain recognizes, okay, there's a deficiency here, I need more, then your appetite will go up. I think training harder is the key to getting your appetite up when it comes to building muscle. But yeah, that's it in a nutshell. I'm happy to go into any more details you'd like if that's useful.
Yeah, one of the criticism of the diet is, and like fellows like a friend of mine, Stan Efferding, who promotes something called a vertical diet, which is a lot of meat and eggs and things like that, a lot of saturated fat. So he's good on that. And then he also promotes quite a bit of like things like rice because it tends to stimulate appetite a little better. And a lot of people have complained, I can't put on size in carnivore diet because I don't have enough of an appetite. So how do you just naturally have a big appetite? I do. I can eat a ton, so I don't have a problem with it. But what about people that struggle with eating enough and they're just full all the time? How do we get past that, you think?
I think besides training harder and having more activity, I might suggest that person looks more carefully at their macronutrients. Is their digestive system so slow because they're bogging themselves down with loads of protein, which, as we know, it's not an energy source, it's not energetically dense. So we need to look at the individual macros as they are. I find a lot of people as well, they tend to almost over-exercise. Like I get sort of client intake forms all the time, and I'll put below, outline your activity, what you do in a given day, and it'll be, tell me what you do in a given day pretty much. Then it'll say sedentary, mildly active, moderately, or very or extremely active. Most people that are extremely active, so I'm talking about people that do 3 weight sessions a week, walk the dog every day for half an hour, and go to like different classes and things, they'll just put slightly active. I'm thinking that's definitely not the case. You're definitely doing more than, 30 minutes of activity a day. So yeah, I think people underestimate how much sometimes they're active they are. And on the same token, there are people that are very inactive. Lots of people I speak to sometimes, understandably, people that are on a carnivore diet don't often have excellent health statuses. They're approaching this from a point of a very sedentary standpoint. So for them to increase their appetite, if that was something that they wanted to do, I look at finding ways to be more active. And it doesn't have to be bodybuilding like what I do, or loads of activities that Shawn does, like rowing and heavy lifts. It can be something as simple as just standing up and sitting down, walking up the stairs, doing lunges up and down the house, carrying some shopping bags, do like a farmer's walk or something. There's lots you can look at, but I think appetite is stimulated by activity. Some people go the route of putting carbs back in their diet. Yeah, that is a short-term fix. But in terms of long-term health outcomes, I could not advocate that personally, at least in my experience of people with binge eating issues and what the carbs themselves in plant food sources have actually caused them, the issues around that. So, yeah.
Yeah, one of the things that goes hand in bodybuilding, particularly at the professional level, is the use of steroids and drugs. And you mentioned when you're at your maximum, you were juiced to the gills and stuff like that. What do you think the pros and cons of utilizing that? And I don't know, does carnivore impact that in any way, or what are your thoughts on drug usage?
Most people that use any performance-enhancing drugs should not use them. I think there's never going to be a case when using them is beneficial to your health unless, for example, it's testosterone replacement therapy and there's a deficiency, so to speak, in your blood, something that's causing you to feel worse. I think anytime you put drugs in your system, you're biting the bullet. You're saying this could be it. You're reducing your potential lifespan and health span potentially as well. So it's not something I advocate or advise people to do. There are better means of doing it and safer means of doing it. So if someone is going to do it, they have to look at their blood tests, be very careful about what they're putting into the system. And I'm not just talking about blood tests alone. I'm talking about scans, coronary artery scans, the measuring the size of your heart, looking at your kidney filtration rate through nuclear tests, lots of things you can look at. A blood test alone won't outline whether what you're doing is safe or not. The other thing as well is you have to be, the reward of using them and getting the benefit out of them has to exceed the risk, in my opinion. So, for example, we might look at professional athletes. Their benefit in terms of their monetary value from what they gain from using them and performing better could be worth it to them. The average person, it's not warranted, I don't think. There's a lot more risk at hand. And yeah, you'll get there quicker, but people like Shawn, drug-free athletes, you could look at them for inspiration and motivation, find there are people out there that are drug-free that have achieved a lot of things. It's not a mainstay of being successful as an athlete. Drugs just add a cherry on top. It doesn't mean to say that you can't achieve a lot in spite of using them.
Yeah, I'm not going to use myself as an example. I'm aware of a lot of guys that have been very strong and very muscular and very good athletics without using drugs. I'm pretty convinced that they didn't. But again, it's become pervasive. And most, if you think, are you going to bodybuilding to get rich? The reality is you're probably not. Most don't. Now, there's more, I think, with things like Instagram and some of the social media stuff, there's more opportunity. If you get in shape, you can sell stuff to people. And I think some people are utilizing the drugs so they look better on their Instagram page so that they can sell their product or whatever. There's some of that going on for sure. But at the end of the day, again, risk versus reward. What do you think the major risks are for that? Because a lot of people say, there's nothing wrong with it. I've taken it for 50 years. Louis Simmons, who passed away recently, but he would say, look, I've been on steroids nonstop for 40, 50 years, and I'm still doing fine. But so are there legitimate risks, and what do you think they are?
That's a good question. Yes. There's perhaps acute risks, the risk of infection, the perforation of blood vessels. Perhaps they have contaminants in them, these different things, if you're buying them through like a black market and not legitimately getting them from a clinic of some kind. They're probably the short-term things which could happen. The long-term things, left ventricular hypertrophy, raised blood pressure, so hypertension, edema, swelling, perhaps mood issues, but that seems to be, from my anecdote of different people, quite individual. It's not a true firm kind of rule of thumb, really. Outside of that, balding, you can lose a lot of hair. I don't have a lot of hair anyway, but yeah, it's that oily skin, acne. I'm trying to think what else now. There's heaps of things. It definitely exceeds what people might think. And the liver damage, if you're using tablets of different kinds, kidney damage. So that's why I emphasized earlier, get everything tested that you can. Don't haphazardly just go about doing it and think, I'm just going to take it once and be okay. You can be that one guy that gets seriously messed up. So there's an element of safety to be had when you talk about these sort of things, and getting different advice online. Speak to someone that knows what they're talking about if you can.
Do you find, okay, so as far as the training goes, obviously there's training for different sports. If you want to be a track athlete, you don't necessarily train what a bodybuilder is going to do. You're training for performance. And so a lot of people say, hey, you should be doing this. I'm like, well, not bodybuilding. That's not my goal. But let's talk specifically for bodybuilding. Is it necessary to only lift heavier weights? Can very light weights be utilized? Is there pros and cons? I know some of the research says 40% of one rep max or more can result in hypertrophy. But where do you find, that on that spectrum? Do you train heavy very often? Do you train with moderate reps to failure? Or do you do really light reps for, say, sets of 50, 60, 70 reps?
Yes, I like that question as well. You're going to get me started here for about an hour, but I'll try and cut to the fine points. So I believe there is a minimum effective dose for training. I think that is the amount we should reach and not more. I think more training than what we need to stimulate muscle mass and growth is, we don't need more. We just need the exact amount. And how we get to the exact amount is very tricky to identify. So that's why we look at subjective measures like how we feel when we wake up in the morning, our energy levels, different things like fatigue, muscle soreness. We might also look at objective measures. So we'll identify how our strength performance is in the gym. We might film our workouts, make sure our form's standardized and safe. I think there's more than one way to skin a cat. I train with a repetition range typically of 6 to 20 repetitions. At times I use methods such as rest pause or cluster sets or static contractions. I think that there's an element of training as hard as you can, but if you do that and take each set close to failure or at failure, then you'll be at a point of not being able to do more volume. So you have to pick one or the other. So it's either train harder or train longer with more volume. Myself, I train typically 10 to 12 working sets 4 times per week for about an hour. If I need an extra day off per week, so I'll be training 3 days rather than 4, I will take that extra day off. If I need another day, I'll take an extra day off. How do I know if I need that extra day? There's markers I mentioned earlier. Or, for example, I'll look at one workout to the next, say, for example, a shoulder press. If that shoulder press has not increased from 1 week to the next, or at least maintained, that tells me I did not recover hard enough, or I just wasn't training hard enough the second time around. But yeah, I think training has to be specific towards what you want to achieve. You have to pick one goal if you want to maximize the outcomes of that one goal. And you made a really good point just now. You said about people telling you to do different kinds of training, and you want to be fit, strong, and perform well at different things. So you're going to be doing different things that you enjoy to do that you can perform well in. Now, if you came to me, Shawn, and you said, okay, I want to be a bodybuilder, then that might go out the window. You might just do hypertrophy specific training. People have to get their goals sorted out right first, which is the key to any training program. And I think a lot of people get them misaligned sometimes. So yeah, I think scale up or down volume and intensity based on what you want to do, what you can achieve. Be careful not to overtrain, because you can go backwards, and that can ultimately impact your sort of desire to carry on training. And I think a lot of the important things is, which I know the Revero communities are quite focused on, is keeping people on the diet, keeping people having healthy habits. Don't do something that you don't think you can reliably sustain. So find a routine that works for you and works close towards your goals.
Yeah, fair enough. Again, consistency, compliance, sustainability, those are all important things. If something we do is unsustainable, then it doesn't matter. We're not going to do it. One of the questions I often get personally, and not that I'm the world leading authority on this, but I have some experiences, is fueling in and around works. There's a lot of people, they take a pre-workout drink, some caffeine and sugar and all this stuff to get some magic. There's always some kind of magical potion in there, some new compound that some people are advertising that this is the greatest pre-workout ever. It's usually just a bunch of caffeine. And then how much protein do I have to have immediately after workout? What are your thoughts around peri-workout nutrition?
I think ultimately, when it comes to the protein amounts, the last point you made, it doesn't matter really, as long as what you're having over the course of a day is substantial enough to meet your requirements to adapt and recover from the training output that you just gave. Now, saying that, you don't really want to be training less than maybe an hour and a half after eating. I'd give it a window of time. Now, some people out there can have a ribeye steak or loads of eggs and just train immediately after. Some people can do that, but it seems to be few and far between based on what I've seen online and people I've spoken to. When I train, I typically drink about 300 to 400 milliliters of water. That's not an exact amount. That's just what my first seems to require me to have. And I'm saying that it's important to be fed before training. That might mean, though, if you're feeding yourself the day before training, so say you eat at 6 p.m. the night before you train in the morning, that last meal is what's going to impact your next training session. Staying hydrated is also very important. When I say hydrated, just drinking loads of water for the sake of it and diluting your electrolytes out of your system and diluting the B vitamins, getting pure hydration in as and when your body requires it and tells you to drink more. Salting your food's taste is also critical. In terms of like post-workout, I typically eat about an hour and a half to 2 hours after training, not because I think that's a must or requirement, but because that's when I'm hungry. That's when my appetite is stimulated. So my rule of thumb thing for everything in regards to protein is eat when you're hungry, don't eat when you're not. Your hunger signals will promote your appetite or provoke your appetite as and when they need. And when it comes to different supplements and pre-workouts, post-workouts, all sort of thing, at the end of the day, I'm sure probably agree, is their products. They aim to sell something to you. They're things that you don't need. They're supplementary. There's some indication that some things are useful, perhaps beta-alanine, taurine, citrulline, different things like caffeine maybe. All I'd say is you can use those things, but they're not needed. I'd say over my training career of using all these different things, I'd say they made a marginal increase in performance, but in terms of how that translates to long-term physique progress, I couldn't say it'd be worth it. Now, sometimes you'll take things like citrulline, you'll get a better pump in the gym. That's always nice as a bloke to get around with like swole arms where they gain like an inch or so. But it doesn't necessarily mean that you're going to have better physique outcomes like long-term down the road. Like I said, I'm not a big fan of products and supplements and things and buying more than what you need. I think all that you need to benefit in terms of bodybuilding on a carnivore diet can be found through the diet itself. Anything else is going to give you perhaps at best a marginal increase, but that's essentially it really.
Yeah, I mean, there's some thought that while you're actively working the muscles, you're in the middle of your workout, they are very receptive for nutrients, and nutrients are being transported in there. And that's the justification where you want to have this pre-workout with all these essential amino acids and other things to help shuttle those nutrients into the muscle while they're working. But what I found is that if I have a big steak in my belly, nutrition is going to be leaching into my bloodstream for many hours. And so I'm still in that sort of state where there's a lot of nutrition available. The aforementioned discussion we had about peri-workout nutrition, as you described it, I think mostly pertains to I'm trying to put on muscle and build, I'm trying to get stronger. What about if you're in a fat loss phase? What if you're trying to shred up for the contest? How does that change for you? Do you do fasted cardio, or is there some evidence that fasting tends to preferentially burn more fat cells, or more, there's higher fat metabolism, whereas the downside is often you're more hungry later and you just put it back on? But how do you deal with it getting shredded or cut for a contest?
Okay, so I'll first outline the importance of retaining muscle when you're cutting for contests. You mentioned the preferential treatment for burning fat versus other things when you're fasted. I like to focus all energy when training, whether that be cardio or resistance training, into the weights themselves, into lifting weight. You want to maximize the muscle that you have on your body as much as possible. And when you get very lean, Shawn, you've been very lean in the past. When you get very lean, you don't want to be sat on a treadmill for an hour. You just want to be doing your weight session, then rest, recover, do that sort of thing. I think in many cases, if not all, doing cardio, at least in steady state, can be detrimental to getting shredded. The reason being is it seems to disproportionately stimulate appetite in regards to the amount of food that you're in versus the amount of energy that you're oxidizing. So what I mean by that is, say you're taking in 100 grams of fat per day, then you exercise, and say you could find a way to work it out and you exercised to burn 100 grams of fat. I think that 100 grams of fat would actually be a bit more. So I think you actually cut further back in your recovery. You take away from your training performance because you're less fueled. Your fired output will reduce as well. That's another noteworthy thing. So it slows your metabolism down. All efforts should be focused on weight training. And if, for example, you want to find a way to have more energy expenditure, then add another set to your weight training workout. You might do a circuit. You might do shorter rest periods. You might do high intensity interval training. They're things that I'd much prefer. So I know they're things that you do, Shawn. So like the rowing and intervals, that sort of thing. So and sprints. So yeah, steady state cardio, no. quite damaging to the heart. It will cause left ventricular hypertrophy. I think it isn't beneficial to lifespan. But on the same token, I'm not saying don't walk your dog or don't go outside and get some fresh air. I think those sort of things are beneficial because they give you a light increase in your heart rate. Getting sunlight is very important. And if you're going to do any cardio at all, do it outside if you can. That's the best case scenario. Make use of the sun, the vitamin D, and modulating your circadian rhythms.
Oh, okay. So when you get very lean, when you start getting sub 8%, and you're getting down to that 5% for contest ready, there is a tremendous pressure on your body to catabolize muscle for energy. You got no fat. There's literally no fat for you to use. There's a tiny amount. How do you prevent that muscle breakdown when you get to that level of leanness? Are you just eating more and more protein to keep it on? How do you prevent from losing that muscle mass?
Yeah, I think the ideal situation is that you don't have to reduce food to that point. Now, like you very rightly said, you'll begin to lose muscle towards the end in most cases. That's a point where I'm focusing more so on my resistance training workouts. So I'm hyper focused on maintaining strength as much as possible. We know that if we can retain strength, chances are we haven't lost muscle. So that's something where being a bit more focused on meal timing is more important. And I'm talking in this specific case when you're very lean, you have to be more critical of what you're doing and hyper analytical. So you might, for example, put more of your food closer to your workout. That might be useful to some people. You might, trying to think now, add in taurine or creatine, try and boost your stores of amino acids. That might be useful as well. Trying to think outside of that, it seems to be just a case of what just happens when you diet. It's not an ideal situation, but I think chasing food reduction is not ideal. I think there's a limit on how far we can reduce our food intake. I think once we get to a certain point, then you start adding in activity for trying to lose more fat. So that's the case where I'd say, okay, I'm on, say, 200 protein, 200 fat, or happens to be at the time. I don't want to get any lower than that because my nutrient intake is so low. So that's the point where I'd say, that's my hard limit of how much I'm going to cut down to. I'm then going to increase activity somewhere. Now, you don't want to be just sat on a treadmill, like I just said. You want to be focused on your training and your weights workouts, but it's a hard state to get into and it's a hard state to maintain and is extremely challenging. So if, like I said, at kind of the start of this, get your ducks in a row at the beginning, make everything as economical, ergonomic, and easy as possible. So when you actually get to that point where you're very lean, you suffer a lot less. It's a tricky thing to get into, but I think muscle loss can in most cases be inevitable, particularly if you're doing a hard cut to get like truly shredded, like lines through your glute muscles and cross-striated hamstrings kind of shredded. That's when it's going to be tough.
One of the things I had a chance to talk with a lot of physique competitors over the years, and a lot of them will talk about some of the negative things that occur in an attempt to get there. A lot of women have hormonal issues, a lot of people have gut issues, thyroid problems, so on and so forth. How has getting to a very lean state on carnivore compared to doing it maybe the standard bodybuilder, the lean chicken breast and the broccoli diet? How have you found? Has it made it better, easier, or what are your thoughts?
I'd say it's definitely made it easier for myself. I come from a background of binge eating and just eating way too much of the wrong food, basically. Now, because I'm limited to a handful of foods, basically, I'm not thinking about food as much. That's not to say you don't have those major energy dips when you're very lean. When you're very lean, there just simply isn't enough substrate to go around to keep your brain cognitively switched on 100%. But saying that, the main thing for me has been the appetite regulation. I find it much easier to get into the lean state because there's less to think about, less to worry about. When you go into the shops, you're not buying 50 different foods, you're buying like 5 or 6. So it just makes it a lot easier in that kind of regard. It's definitely a less stressful experience. And I find it easy also to track your food intake, which is much more important when you get very lean. I think someone can get to 10% relatively easily just by reducing their food intake, but getting to that very lean state, you do have to track things very carefully. Now, when you're eating, for example, ground beef, that's 80% lean, then you might think, okay, I'm going to reduce that by 10%. So that's 450 grams. Now, if I was to do that same practice on a conventional bodybuilding diet of chicken and rice and all sort of thing, and microwave this, that, and the other, basically things with packets, products, like I mentioned earlier, then you're going to have to accept that you have a 20% margin of error for the calorie amount in each of those given foods. And those nutrition labels are not accurate, I'm telling you, because I've actually weighed some of these things, like microwave rice and ready baked potatoes and all sort of things. They're nearly always off. Whereas if you go to the butchers or go to the shop and buy a pack of ground beef, you buy 6 eggs, you can reduce those things incrementally and actually weigh them yourself. The chances are, if you're buying from the same food source, it's much more accurate. So that's another thing as well. It makes your job as a bodybuilder to work for coach perhaps and actually reduce your food intake without all the extra stress of counting this, adding this, and just working through macros, because that adds another level to the calculation, which makes things much more impractical and difficult. So overall, like I said, much less stressful experience.
Let me ask you, there are people that are year-round pretty lean. They're 10%. They got visible abs. What is this? Is there a secret to maintaining that? Because as a bodybuilder, a lot of people often, they'll get up to 15, 20% body fat, try to put on a bunch of size and muscle, and then inevitably cut down to contest size. But is there any particular thoughts on, I'm just going to maintain a relatively lean, like I said, sustainable 10% body fat? What are your thoughts on that?
Yes, I think that the most important thing is to be patient and build up the muscle you need. And like we mentioned earlier about being specific with your goals, I know people are perpetually in that bulking cutting phase. I'm going to do a 4-week bulk, then a 4-week cut. I think to gain muscle and retain it at least, you have to acquire it over a longer period of time and hold on to it. So you have to build up the strength as a result of the extra muscle mass and vice versa, and hold on to it for as long as possible. So pick one goal and maintain it. Then when you've built enough muscle mass, so you look at yourself thinking, yeah, my arms are big enough now, or whatever it happens to be, they can start looking at trimming down the waistline. And you'll find out soon enough if you've got enough muscle in you, because when you lean down, you'll see everything deflate and disappear, which a lot of people do. It's very common in bodybuilders. So I think the main tip is to build enough muscle mass to find it. The more muscle you have, the more food you can eat, essentially. And it takes more energy to keep yourself going. So I think that if you can build that level up to a point where, yeah, you look at each meal thinking, that's a substantial meal. I feel satiated from that. It's enough food. It doesn't feel like a tiny portion on a plate. Then you can start to reduce the body fat. I think it is you have to be specific, and it is quite a staggered approach that you have to use. I don't think it's something where you can just, at least when you become more advanced, it's not to say you can do both at the same time. As you become more advanced, you can't build muscle and lose fat at the same time. Maybe the first year, but beyond that, it becomes a lot more tricky.
Yeah, fair enough. Jonathan, unfortunately, we've run out of time. I've got to do a consultation right now. Congratulations I'm glad your surgery went well. You recovered from that. I look forward to meeting you in person in a few weeks. So thank you very much. And where can people go to find out more about Turbine? I know I think you do coaching services, things like that. Where can they go?
Thank you, Dr. Baker. I appreciate it a lot. Yes, so I have a YouTube channel, which is Composition Consultant, Instagram, which is composition_consultant, and my website is compositionconsultant.com. I do different services, so diet and training plans, affordable rates, like truly affordable rates, not ridiculous $100 kind of thing. Consultations also affordable, and I do coaching as well. So everything we talked about in this kind of discussion is what I'd offer to someone in a consultation if they're to ask me the same questions. And I keep it very simple, affordable. I've got different means of being contacted, and it all seems to follow what my mantra is, which is aligning physique goals with positive outcomes.
Okay. Thank you very much. And folks, we'll see everybody tomorrow. Take care. Thank you, Jonathan. I'll see you in a couple of weeks, man. Bye-bye.